CDC. Flu season, it's bad, and it's actually getting worse. The latest numbers we're just getting: 51 deaths in Georgia, one of them a child from Coweta County. In fact, 17 children around the country died in the final week of January alone. Hospitalization rates are at the highest they've ever been for the flu season at this point in the year. On every platform possible, email, Facebook, calls into our newsroom, you're telling us this is a story that matters most to you and your family, and it's why we're spending so much time covering flu today. We have team coverage, reporters following the latest on the fight against the flu. Let's begin with 11 Live's Joe Henke, who's clearing up some of the confusion about the test to check for the flu.
When 15-year-old Kira Molina began feeling sick, her parents took her to a clinic near their Noonan home. Results from a rapid flu test came back negative.
They said that it was allergies, sent her back to school in 2 days.
3 days later, Molina's parents found her unresponsive and rushed her to the ER. She now tested positive for the flu. Molina died 5 days after her first test. A flurry of flu test questions followed her death.
One of the things we're seeing now in Metro Atlanta and nationwide is that there's a shortage of the rapid flu test. So it's not even available. For example, in our urgent care centers, it's not available right now.
Dr. Dan Salinas is the chief medical officer with Children's Healthcare of Atlanta.
This is all about empowering families to do what they can do.
Salinas urges parents to take a first step, which actually does not include a test.
In general, what parents should do is consult with their primary care physician or their pediatrician if they think their child has the flu. A very important point, though, in most instances, their child is not going to be tested for influenza, because influenza, the diagnosis can be made through clinical findings.
Your child's pediatrician should be able to diagnose your child with a physical examination and their medical history. This also frees up tests for children with other health issues.
In general, that test is reserved for children in whom the influenza could cause severe complications, so children with asthma, diabetes, other severe diseases.
If your child is given a test, here's how the CDC breaks down the options. A rapid antigen test gives you results in under 15 minutes, but can result in false negatives when flu activity is high. The rapid molecular assay test returns results in 15 to 20 minutes and is more accurate. And specialized lab tests are the most accurate, but results can take hours or days. I'm Joe Henke, 11 Alive News.
You know, it seems everyone knows someone with the flu. Local schools are seeing a huge impact. Absences are on the rise. One school district is using the weekend to do a deep clean, hoping to get an edge on the flu season. 11 Alive's Latasha Gibbons continues our team coverage tonight at Oakview Elementary in Decatur, where crews will be wiping down the classrooms over the weekend.
That's right, Vinny, and we'll show you that in just a minute. As you know, multiple schools around the metro have reported a high number of students being absent, and most cases have to do with the flu illness. And because of that, officials here want to take extra measures to make sure they're doing everything they can to protect students. In DeKalb County alone, 6 schools this week have had at least 100 students absent each day. But I'm going to show you what they're doing to combat this. Take a look over here. This is Mr. Bruno. He is the head custodian here at Oakview Elementary. And in that spray bottle is a special mixture just given by the school district. And as you can see, he's not just wiping the table, but he's wiping the pencils, the scissors, everything that students can come in contact with. But DeKalb County is not alone. Fulton County has 4 schools reporting higher than 10% absences. In Cobb, officials report students who are sick are staying out longer, while Henry County has seen a slight uptick in students being sick, but there's also a high number of staff members who are using sick days. Atlanta Public Schools report no change. Now, we talked to a father whose daughter is one of 8 children in her 2nd grade classroom to get the flu this season.
The school called me yesterday when she was throwing up and had the headache at school, so they acted pretty fast. Luckily, we got her the flu vaccination, so she wasn't as bad as the other kids in her class. It's hard because, you know, they still are kids, and we're trying to teach them, you know, keep your germs to yourself as best as possible, but they're still kids.
And I also reached out to a handful of daycares around the metro to find out what they're doing. And many of them I talked to say they have what they call germ bins. Anytime a student touches a toy or book or something and they're finished with it, it goes into a bin and is taken out of circulation until it's been sanitized. And one daycare in particular I talked to say they have special microfiber filters in their AC and heating unit to make sure it catches all the germs in the air. We'll have more on 11alive.com. Vinny, back to you.
All right, thanks so much.
Thank you, Latasha. A lot of stories circulating on social media, actually spreading around almost faster than the flu, you could say. There's a Facebook post from Atlanta claims that breast milk fights off the flu. Several of you saw the post in your news feeds. You asked us to verify it. Caitlin Ross is tracking the source and the truth of the claim.
I talked to the mom who put this up on Facebook, and she has been shocked by the reaction to it. She's comparing the breast milk from before her daughter got sick to the breast milk after her daughter got sick. Her 10-month-old was just diagnosed with the flu, and the nurse in her doctor's office told her to go home and pump breast milk, then compare it to breast milk from before her daughter was diagnosed. This is the result. You can see it looks different. The nurse said that's because the antibodies that are helping to protect her daughter are at work. That's why you see the different colors here. So we wanted to know, is this true? We talked to two different doctors, Dr. Sujatha Reddy of Perimeter Women's Health and Dr. Taha Shakir, a pediatric doctor. Both told me breast milk can change color for any number of reasons. The mother's diet, when she last pumped, the size of her supply, but it would not show antibodies, meaning you can't tell the difference by just looking at a picture. So that claim is false. But does breast milk help protect children? Both Dr. Reddy and Dr. Shakir agreed that it does. They say that antibodies are able to pass from the mother to the child and that a mother's body will actually change depending on the needs of her child. So that claim is true. And a couple things to note, Dr. Shakir says if you're diagnosed with the flu, it is still safe to breastfeed. It's safe for you to take medication and then breastfeed, but breast milk is not medicine. If your child is sick, they need medical attention.
Caitlin Ross, thank you very much. The place to go when you need information on flu in our community, 11alive.com/flu, and you can check back every day to stay on top of this outbreak.